This video lecture is going to start us off to the major immune disorders. There are three major categories, and in this video, we're going to talk about autoimmune disorders. Now, heading back to our outline in PowerPoint, in an autoimmune disorder, auto self attack. And so right there, lymphocytes attack self antigens. Something has gone wrong that you have antibodies and or lymphocytes that are targeting your own tissues and destroying them as if they're foreign invaders. And once those antibodies or those helper T cells do that, they go back to the thymus or the spleen and they tell them, we found something. The thymus and spleen, they're just drones. It's okay, we'll send out, we'll send out other antibodies and we'll send out cytotoxic cells to respond. They don't ask, wait a minute, that sounds like liver to me. They just go. And so something's gone wrong out there in the plasma with the antibodies or the helper T cells themselves. Future videos, we're going to talk about hypersensitivities and immunodeficiencies. We'll show how they differ from autoimmune. Now, for an autoimmune condition to develop, there's usually three factors that have to come together in some combination. We find that some autoimmune conditions are inherited. And so that means that, if you have an autoimmune disease, not all of them, but in some instances, you may have had a parent who transmitted to you a defective gene that made a helper T cell more likely to screw up past testing to survive long enough to then attack your tissues. Or you may have had certain regulatory genes that normally would kill off those bad lymphocytes during selection, but now don't. And so that's why we'll find some autoimmune conditions that travel in families. Environmental influences, exposure of chemicals, stress can have an impact upon our overall immune function, can suppress it to a level that they start having a bad time properly reproducing the cells and may reproduce something a little weird that now it doesn't react to what it's supposed to, say, for example, mononucleosis. And instead, this thing reacts to something that happens to be cartilage, thinking it's mono. And so something has happened that now it's attacking self and doesn't realize that. Infections. Certain pathogens can stimulate some of these lymphocytes to alter, to change, so that they do attack self cells. And so it's usually some combination of these factors that result in a person developing an autoimmune condition. Autoimmune conditions are the third most common disease in the United States. And so we're trying to learn more and more about how these three factors come together for more and more people. The most common autoimmune disorder is lupus erythematosus. And this is where your body is producing antibodies that attack some of your own DNA and RNA sequences. Now, that means that it can attack cells in any body tissue, any organ system. Doesn't mean it attacks all DNA or all RNA, but it attacks certain sequences. But unfortunately, if those sequences are common enough to multiple tissues, it can damage multiple tissues throughout the body. There may be a lot of internal effects that we don't see per se, but if it attacks the skin, any of the dermis or epidermis, we will see this react with a rash, with redness, and with itching. That's usually our first indication of an autoimmune condition. They can also go for internal structures, damaging connective tissues, damaging neural pathways, cardiovascular systems. It varies. There are four major types of lupus erythematosus, and the most common is SLE, systemic lupus erythematosus. And this is the one, as the name implies, systemic, is usually going to be affecting surface and internal structures. This is usually a very chronic condition that will last for years and years. Outwardly, you'll wind up getting this low-grade fever and a butterfly rash that may appear across the face, across the chest, or across the back. And that usually depends on a certain photosensitivity. Exposure to sunlight usually causes some of these cells to, in the tissues, to dilate blood vessels and cause a lot of that reactivity. That can change blood pressure effects a lot, which can tend to make the cardiovascular system have to work harder, which can usually reduce metabolic reserves, and the person feels fatigued. These are the low-level common things we see in a person with systemic lupus erythematosus. It can flare up to the point where it can cause tremendous joint pain, severe migraines, visual auras, digestive imbalance, vomiting, constipation, and so forth. It pretty much depends on the person how much of a autoantibody load they have running through their body. Here's an example of that butterfly rash going across the back. Discoid lupus, also referred to as cutaneous lupus, as the name implies, usually is limited to just the skin itself. It'll create these red raised lesions on the skin and usually does not damage internal structures. We give them a little bit of immunosuppressant therapy, try to reduce that autoantibody load, and it usually clears up pretty well. Neonatal lupus erythematosus, this is where there's some reaction from the breast milk to nursing babies. Some type of maternal antibody gets through that actually attacks newborn tissues. There's usually filters against that, but if this happens, it can cause skin rashes, it can cause soreness inside, a lot of irritability. We used to refer to this a lot of times as colicky. Treatment is simple. Stop giving them the breast milk. We'll give them processed nutrients instead, and they'll clear up. Drug-induced lupus erythematosus is where there's been some cross-reaction with medication that causes certain common tissues to appear to be non-local, and so your antibodies will attack them thinking that they're foreign. And so you'll wind up getting these reactions throughout the body, but what we see then is that skin reaction running across the skin. Yes, that is my upper limb, and that's where I found out that I was now sensitive to amoxicillin. And so amoxicillin would get through my bloodstream and would cause all of my skin cells to decide to pick a fight with antibodies, and I had this reaction from head to toe. Had a high-grade fever that spiked, itched like, oh my God, until like the whole body flew. Stopped taking the meds, it cleared up. Simple, simple. There are several types of autoimmunity. I do want you to be able to understand how systemic lupus erythematosus works because this one is the most common. But I want you to recognize there are other types of autoimmune disorders. For now, that's the only thing you need to know about this list is that they are in the autoimmune category. On your quiz or exam, I could give you a multiple choice question where I could say Kawasaki disease is an example of an autoimmune immunodeficiency, hypersensitivity, or cancer. And if you know it's an autoimmune, for now we're good. Later organ systems, when we cover joints and skeletal issues, we'll learn more about rheumatoid. We talk about the thymus. We'll talk about Hashimoto's. We talk about muscle and nerves. We'll go into fibromyalgia and multiple sclerosis. We'll cover those in more detail later. For now, simply recognize them as autoimmune diseases. I do want to take a moment to talk about Crohn's disease. This is a hypersensitivity that occurs within the intestines, usually the large intestine. It acts and looks like an autoimmune disease. It is not. We'll learn a lot about it in the digestive system, but I want to just upfront tell you a lot of people misinterpret this as an autoimmune. It is not. And so we'll save that on the back burner for now. All right, that takes us through the autoimmune disorders. Know how an autoimmune disease exists. Be able to describe for me the elements of systemic lupus erythematosus, and be able to recognize the names of the major types of other autoimmune diseases. Flashcards are a great addition to this chapter, helping to keep track of which ones are autoimmune, which are hypersensitivities, which are immune deficiencies, and so forth. Good luck.